Welcome. Today is August 14th and it is Friday at 4. So, once again, it's time for our uh, now called Coping with COVID with Dr. Shelley. As you guys know, I am a board certified gynecologist specializing in anti aging, hormone balancing, and wellness, and I'm located in Central Florida. We've been doing this broadcast once a week. Almost since the beginning of COVID, just to kind of share information that's out there, give you an update for those of you that hopefully do not watch it too closely every single day. So I try to kind of recap the week for you, just to kind of give you the down and dirty, and then discuss. Now we're aiming to discuss one thing that maybe we can either get more information on or use to help in treating ourselves to make ourselves feel better while we're going through coping with COVID. Because as we see now, this is not going away anytime soon. So we are going to have to cope with COVID being in our lives. This is not going to be, unfortunately, something that's going to go away quickly and then maybe come back. Now, most parts of the world and definitely within the United States are looking around saying, hey, we need to be having plans in places for how this new norm is going to work all the way through until January. So our fall, because we already know that the fall is when we start getting the flu symptoms and stuff and all of that coming in anyway. So we're going to be dealing with not only COVID, but flu season wrapped in with COVID. So it is definitely not going to be a resolution of the actual COVID crisis anytime soon, unfortunately. So we're going to just have to learn how to deal with it. So let's go over the numbers real quick. Then we're going to talk about, today we're going to just talk briefly about zinc because you've heard a lot about that. And so we'll brush on that, anything else that you have to discuss, and then we will try to get you out and get you to starting your hopefully gorgeous weekend wherever you are. I can tell you that here in Central Florida, it is roasting. It is really, really hot. So it's definitely either you need to be getting wet or you need to be inside with some air conditioning. So what are our numbers this week? The worldwide with COVID, we're at 21.2 million cases worldwide. Within the United States, there are 5.45 million cases. So that means we're responsible for a fourth of the cases, more than a fourth of the cases worldwide. The top three of us, Brazil, India, and ourselves, are responsible for more than half of the cases across the world. So that's definitely not good, and definitely not good considering that the United States is supposed to be, we would hope, we would pride ourselves in being very good in our health care system, even though we know that we're not ranked as one of the top healthcare systems. And I think that this is one of the things that is showing us that we do have, unfortunately, a lot of bullet holes in our system that need to be rectified because we should not be leading this pandemic. The number of deaths worldwide is 760,000, 171,000 within the United States. Now, survivors, yay, 14 million survivors. So that's wonderful. That's excellent. And within the United States, 2.85 million survivors. So we definitely are excited for our survivors. And we don't want to, as with any of these diseases, with any disease, whether it's COVID, whether it's cancer, or whatever, right? I always tell people you don't want to get it, but if you get it, heaven forbid, you certainly want to be a survivor. So we're definitely very happy that there is a significant amount of people that will definitely survive contracting COVID. The within Florida, we have 563,000 cases, up from 510,000 last week. And remember, these are weekly data marks. So, like within the United States, we're up another 45,000. Actually 47,000 cases from last week. Within Florida, we're up another 50,000 cases since last week, and our death rate has gone up from 7871 to 9276. So that's over 1,000 more deaths, and we were over 1,000 more deaths last week. So we're losing, a significant amount of people every week. So that definitely is concerning. And it's when you look at statistics, and unfortunately we're hearing this over and over again, so because we hear it all the time, we're almost getting a little immune to this numbers. But remember, these are real people. These are real people that are dying. They're dying in a hospital by themselves, without their loved ones, and there are loved ones that are left suffering with the loss of that person. So any death is one death too many. The we have had within Florida, the overall testing rate positive was at 8% yesterday. Overall, completely is at 13.5%. Remember, our goal is to get less than 5% to be considered contained, to be holding our numbers in place. The and we were at 13.2% last week, so the number hasn't changed for the overall census. We haven't seen a significant drop, but we are going a little bit lower than we were. So we're seeing, like I said, 8% is the lowest we've been in a long time as far as our positivity rate. So we're hoping that is a step in the right direction, and that we don't take that as meaning that, oh, everything's okay and we're going to just go back to business as usual. Because every time we do that, guys, that's when we start to have problems. If we would just kind of toe the line, I think that we could potentially see much better improvement than what we're doing right now. The good things within the hospital, the bed availability is good within Central Florida. We are discharging people. People are the number of people on the vents, etc., is much better. Now, let's look at that data real quick. If you go back 2 months, the number of people in the hospital that were positive for COVID was 41. So we're talking about the beginning of June. We got as high as 433. Now we're at 171 as of 2 days ago. ICUs. There are 34 in the ICU within Orlando Regional Hospital, which, as you guys know, is one of the main systems here, and 42 that they call rule out, where they're ruling out whether or not they have COVID or not. Once again, to put things in perspective, we have 26 patients that are ventilated that are either COVID positive or COVID pending positive in the ICUs. That's up from 0 on June 7th. So the numbers are still there. We are and so even though it's better than it was a couple of weeks ago, we are not, by far, where we want to be, but at least the numbers are not going up, at least here in Central Florida, even though the overall hospitalization rate is up across the state. So there are other parts where they're not seeing as much favorable data as we are. But there is over on the southern side, on the west side, Sarasota, Manatee County is also seeing some improvement in their numbers. So that's a good thing, because they are an elderly population and they're more of a hot spot. And the new what's going on, we have the New York City has been holding fairly stable, and they're actually opening up at 25% in their museums, and so the museums are opening up a little bit, so that's a little positive as the summer is coming to a close. There are over 150 vaccines that are in trials, and if you've been watching the news at all, you know that Russia is declaring that they have a vaccine that they are very pleased with, and that they will be rolling out in October into the general public. Now, they have not done what we call phase 3 trials as of yet. They will be actually trialing their the public and healthcare workers. So we're going to talk a little bit more about vaccines at a future talk. So I won't get into that now, but I would not be too excited about that. So so we are in stage 3 testing of vaccines here in the United States. So that's favorable, and we're hoping that we will see some improvement. The still recommendation is that we won't have the still thought process is that we will not have a vaccination here in the United States until the very end of the year at the earliest, or early into next year. But things change all the time, but at least they are working on it actively, and there are multiple different entities doing that. So it's not just everything's not in one basket. Um, there's a I just wanted to mention to you. So we are seeing, as we said, because of a lot of the improvement in the medical stuff, that we are getting more information, every single day we're learning more about the virus, and so people are surviving, and going home, which is a blessing. It is definitely a blessing. One of the issues is, though, and we can't forget this, even people that have mild symptoms, we don't know what the long-term sequelae of all of this is. And we are seeing that definitely there's a group of people, they're calling them the long haulers, where they have significant prolongation of their symptoms. So even if they're mild, they're just not going away. Almost everyone that you speak to that has had COVID, whether they had mild symptoms or severe symptoms, still complains of fatigue for several months afterwards. And that may not seem like a big deal, but if it's you dealing with it, and I mean, we're talking about some significant fatigue, it affects your overall life significantly. And the CDC did a study and said that basically there were at least 35% of people, even 2 to 3 weeks later, that had still significant symptoms associated with COVID after they had been treated. And then there was a smaller study out of Italy where they had over an 80% of their people that were in the study had at least one symptom still existing from COVID after 2 months. So this is something that, once again, it's not necessarily, as one of the physicians was saying, it's not necessarily black and white, like, okay, I get COVID and I either die or recover and life goes back to normal. So we need to understand that, and that's one of the things I've mentioned before for our young people, is that yes, you have a much higher chance of surviving COVID, but that does not mean that you could not potentially have some long-term side effects, and we don't really know what those are. It could be issues with just chronic fatigue syndrome. It can be prolonged loss of taste and smell. New one, hair loss. They're finding a lot of people are having significant hair loss who have had COVID. Now the question is also, we know with hair loss that can be associated with stress. So is it the stress from having COVID and everything that goes with it, in conjunction with COVID, or is it something actually completely separate that is specifically due to COVID? We don't know. But there's several different things that we're seeing. And then the biggest one is, and I'm seeing this in people, whether they've had COVID or not, is the anxiety and stress has gone markedly up. And they're saying that over 40 to 60% of people are suffering with anxiety. I can tell you, people that recover, if they had any type of lung issues associated with COVID, so if they had a lot of difficulty with breathing, heaven forbid if they were intubated, they have a major a post-traumatic stress disorder afterwards, where they're afraid. They're afraid to sleep soundly because they're afraid they're not going to wake up and be able to breathe, or they're going to die in their sleep. And so this is serious, and these are long-term things that we're going to have to deal with for a long time. One of the neat things is that Mount Sinai has actually developed a center specifically for post-COVID patients who are still symptomatic. So if you know someone who is quote unquote a long hauler and experience significant symptoms still, they should look into that. And hopefully, if they're not in New York, they could, we've got all this wonderful telehealth and stuff, that they could still be enrolled and followed. And that's how we're going to get all our data, is by following our survivors and understanding how this disease is playing out. So that's a little interesting thing that we need to think about. And before I forget, that's one of the things I want people to pay attention to as far as we've got a holiday weekend coming up. And so there's a whole thing about, there's a whole group of people saying, well, we're just going to do herd immunity. We're just going to get it. Let's just get it. Let's get it over with. And then if the majority of people get it, then we don't have to worry about it as much, and we'll be survivors on the other end. That's fine and dandy if you're one of the people that actually survives without any side effects. If you're one of the people that doesn't, then that's a whole nother conversation. And they are predicting, remember, Americans, as we've said before, everybody thinks they're healthy. Everybody thinks they're healthy. I get people all the time, and they could be 300 pounds, and they'll still look at me and go, I'm healthy, I'm good, kind of thing. So Americans are obese. We have the highest level of obesity. So we have obesity, and we know it's linked with COVID. And then with obesity can go high blood pressure, can go diabetes, and all of those things we know worsen the outcome with COVID-19. So don't assume that, that if everybody gets it, that the majority of people are going to be okay, and that we're going to, and we're not going to see a massive amount of deaths. We know that if this is left unchecked, that we are going to see a significant amount more deaths before the end of the year, and it's a travesty if that happens, and it could be prevented. That's the key thing. So certain things are not preventable, but certain things are, and hindsight's always 20/20. And if we look back, which we are obviously going to look back once we ever get through this, we're going to be able to see a lot of stuff. And I think that our kids and our grandkids are going to look at us and be fairly judgmental of us in the way we handle this pandemic, to the negative, and feel like there are definitely things that we could have done differently to improve survival. So that's just food for thought. And as we are approaching the holiday weekend and you're making plans, please be aware, once again, I see it every day in my office. I talk to a client, and they say, so-and-so got, COVID from their coworker because, of course, they were in a closed environment, but they know that person and they've been hanging around with that person. So what do? They're not wearing a mask, or at home. And yeah, it's kind of weird to be wearing a mask in your house, but you need to basically be talking to the people in your house, as we said, and everybody needs to be doing their part and wearing masks when they're out and around people, and washing their hands, and doing the things that we know can decrease the transmission. Whether you think it's a hogwash or not, it's really not. People are dying. People are getting sick. And your biggest risk is the people close to you. But for some crazy reason, we all feel like, okay, I know that person. I'm looking at that person. I know that person, so they don't have COVID. It's the people I don't know. It's the people that are strangers that have COVID. Sorry, wrong answer. The majority of people that are getting COVID are getting it in close environments with people that they know. So New Zealand did beautifully. They actually had no cases. They just got 4 new cases. Where? All in the same household. And those 4 people worked in different workplaces. So now they're having to go back and do contact tracing to kind of get a hold of this, and they've been doing really, really good. But what has New Zealand been doing? That consistently since the beginning, they cracked down really hard. They did a hard quarantine, and they are dogmatic about the mask and contact tracing, and so they've seen really good results. But it just shows, even in their situation, they closed their borders, etc. They did a lot of different things. If you're interested, you should really look into that. It's pretty amazing, all of the things that they did to get control of their virus, and they did. But right now, are they still, did somebody slip through the cracks? Yes, but they're being really hard on it to kind of control it. Speaking of closing borders, the UK just closed their border to France because France was seeing an increased number. So then France turned around and they've now closed their borders to the UK. We already talked about people closing the borders to Spain because of the increased number in cases in Spain. So pretty much everybody's borders are going to end up being closed, it looks like. And, of course, because we're such a hot spot, nobody wants us to come visit right now. So we're definitely going to be at home for the holiday weekend. What else do we have? Within Florida, that we went back to school this past Monday. A lot of the schools opened back up. here in Orange County, it's virtual. Lake County has not started yet. They are planning to go back on the 21st, and they have several things, at least at this point, and they have several things in place to try to decrease transmission. They also are offering the virtual option, and they're going to be testing all of their staff, teachers, and recommending testing for any students that want to be tested before they come through the door. But it's going to be mandatory for the staff and the teachers. So that's at least a step in the right direction, and they'll be able to do the rapid test because, of course, it doesn't help if you're test positive and you find out a week later because you've had all that exposure the whole time. So they are going to have access to the rapid test in Lake County. So we shall see how that rolls out. Did I do the Lake County data? We're not going to do the data this time. Basically, the numbers just short and skinny. The numbers are slightly up in as far as the deaths in Lake County and in Orange County. The median range is still in Orange County 36, Lake County's 40, 41, just like the rest of the state. Orange County had over 1,000 more females testing positive than males. And across the state, we're seeing more females than males, but most significantly in Orange County. So it'll be interesting to follow that data and see how that's panning out as far as survival, etc. Also, I'm going to start watching the children's data, which I hadn't been doing before as much, but now with the schools going back. So I can tell you within Florida, we've got... our biggest chunk is actually in the 15 to 24 age group, but we're seeing some numbers come, the 23 to 34, but we're seeing the numbers going up in the 5 to 14 and the 15 to 24. So we'll keep an eye on that over the next couple of weeks and see as schools reopen what's going on. Palm Beach County, which is a county that went back to school, they've already had to shut down a whole classroom and a school bus, and with throughout the because of a positive child, and throughout the state, the United States, they've had over 2,000 COVID positive cases that are attributed to the school systems, and so those schools are scrambling with contact tracing and closing, and how they're going to handle that. So we're going to see more of that as the schools open up, and just hopefully people learn from other people's mistakes. Right? No reason to make your own if you can avoid it. Georgia's under scrutiny because, as you know, Georgia has not been requiring masks, but they have seen the highest amount of deaths over the last 3 days there, and the highest number of cases. And that probably is coinciding along with the schools opening up and more exposure there. So we'll see how that pans out as well. So keep an eye out on that. And I think that's pretty much what I wanted to talk to you guys about as far as the updates for this week. As far as our governor mentioning that going back to school it was correlated to a Navy SEAL operation that killed Osama bin Laden, and so he got a lot of criticism for that. If you didn't see his response to that, in what he stated was, and actually from my understanding that wasn't actually his statement, that was the statement of one of the people in the school system that he was speaking to, and it wasn't that he was saying that he thought that going back to school was as dangerous as the Navy SEAL operation, but that the Navy SEALs had to be motivated and ability to handle any situation that hit them in order to be successful in their operation, and that's what the school systems were going to have to do in order to be able to deal with this crisis. So just to clean that up again, because of course one wrong word can go. In his defense, it wasn't actually what he said, but he did repeat that statement, and it came off kind of wrong. But he's apologized for that. Okay, let's talk about some zinc if you guys want. And as always, you guys are a quiet bunch, which is fine with me. But if you have any questions, feel free. So we hear about zinc, we hear about zinc, we hear about zinc. And a lot of the healthcare professionals, even in the very beginning, were basically saying zinc, 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 zinc. So what is zinc? Zinc is a mineral. You can get it in foods such as meats, fish, chicken, nuts, beans. So it's in a lot of it is in a lot of foods. Lori said, "Stay home for the holiday." Yes, that's always good. Yes, if you stay home, if you quarantine yourself, then that's the best thing. And if you're gonna, like I said, be out on on the Labor Day weekend, be outside. Do practice, wear your mask and social distance. Do not be inside of a closed environment with, I don't care if you know the people or not. You do not need to be in a house party situation where there's liquor involved and you're going to let your guard down. You're going to be talking over top of music and you're going to be inside of a closed space. Not a good option. At all. We do not store a lot of zinc in our body system. Some minerals and vitamins you can actually store, and so you can build up levels and kind of have some left over for a later day. Well, that doesn't really happen as much with zinc, so you do want to be getting it into your system. Most of you guys know airborne is high dose zinc. And what's the other one? It's another one that's sold readily over the counter that people take for their colds. And so it does appear to lessen symptoms with the common cold. Whether or not it's actually helpful for either preventing COVID-19 or lessening the symptoms, that data is still not there. But it is definitely a recommendation, and it's anecdotal where a lot of people of physicians who are working with COVID patients have seen significant improvement in decreasing symptomatology in patients that have a good zinc intake. So it certainly is something that you should consider utilizing. We don't quite understand exactly how it boosts the immune system, but it definitely seems to have some favorable response there. So definitely something that overall is a safe thing to take. The recommendation is about 40 milligrams, and for most people, you can certainly dose higher. You know how I feel about taking supplements without somebody watching you, though. You just have to be a little careful with that. Hi, Karen. And I saw Kanisha earlier, so hi, Kanisha. I'm not ignoring you. So zinc, besides helping with colds, it's really good for wound healing. It's really good for blood clotting, and so one of the things that we know with COVID-19 is that there appears to be a blood clotting issue that goes with that. So that's another way why the zinc could help too in stabilizing that. It's also good for your thyroid. It's good for your vision, and in another virus that it seems like it might help with for my sexually active people is actually herpes. So that's something that if you are suffer from that making sure that you're getting your zinc in could help you to have decrease in outbreaks. It's also good, it appears that with lung disease, so once again taking us back to the COVID and the results with the lung, it seems to help with that inflammatory process within the lung disease. It's not 100%, like the studies aren't 100%, but it does appear that people say with COPD, which is an obstructive lung disease, that they can function better with high dosages of zinc. And so once again, because we know that COVID affects the lungs, this is not, this would be a good thing as far as recovery and survival with the COVID from that. It's also interesting, associated with male infertility, with helping diabetes and depression. So there's a lot of little positive things that can go with zinc. And the main thing is taking zinc, you want to be careful with zinc on an empty stomach. It can actually irritate quite a bit. So I am a big proponent on, being on a good multivitamin that has zinc in it. I check zinc levels, and if I see that the multivitamin is not pulling the zinc, then I usually recommend that zinc be taken with food and either with lunch or dinner. I'm guaranteeing you, if you put a bunch of zinc in your system, um, first thing in the morning, and you don't have food in there, you're going to be an unhappy camper for the rest of the day, unless you have a lead stomach. And even if you have a lead stomach, if you do that every single day, it's going to catch you. It's just a matter of timing. So why create new problems treating old? If you're going to take the zinc, which I'm definitely do I sell zinc too? I who knows? We have 14 different supplements lines in the office, but as far as I know, we don't have a separate zinc. We, like I said, both of our multivitamins have significant zinc in them, and then we usually recommend that people supplement zinc with their food intake, and then if not, then we would send them out. And have them get zinc, but I don't know. I'd have to look. If anything, probably my Nutrimetrics line probably has a zinc supplement in there, but you caught me because I can't tell you for sure. Have to look into that. So I will post that. Let me double check the different supplement lines. I bet you one of them does, and I'm just drawing a blank on it. So now I answered that question, and now I have forgotten what I was talking about. Oh, so we were talking about the zinc and just taking it with food so that you don't upset your stomach. As you know, and I haven't checked the stores lately. The Zicam is the other one. So it was Airborne and it was Zicam. So Zicam used to have the nasal sticks that you could put up your nose, which was, once again, just high dose zinc. I actually love those, but people were getting crazy, of course, and so the enemy of good is better. So please don't go out and just inhale copious amounts of zinc. With anything, the enemy of good is better, and you can hurt yourself, no matter what it is. And so they were irritating their noses because people were doing just crazy stuff, just using the sticks over and over and over again. And so if you're going to, it's a great thing. I would love for it because it acts like a barrier, so it would be right there. And we know that COVID, the majority of the transmission appears to be by mouth or by nose. So if they still have those, I think it's a great idea. But follow the directions on the box. Do not think that more is the merrier. And because if you end up with sores in your nose, besides hurting, you could actually end up with long-term damage. So I know that at one point they had actually pulled them off the shelf because of that. And I don't know if they're back on or not, because that was actually a couple of years ago. If not, it's fine. You can do the oral zinc, but just watch your tummy. So I think that I've been trying. I think I might actually get close to my half hour this time, guys. And so as with everything works together. The goal is to do a comprehensive supplementation of your vitamins, but the recommendations, my little COVID recommendations, are usually being on a good multivitamin, the zinc, the vitamin D, which we talked about last week, I believe. And no, we talked about stress and stuff last week. But whenever we did. So the vitamin D, the zinc, and we can talk about vitamin C as well. So those are usually our COVID-proof vitamins that we recommend to help you to boost your immune system and to decrease, heaven forbid if you get COVID, hopefully to decrease the symptoms that go along with that. So anyway, I am going to let you guys go because I didn't want to hold you too long. I'm aiming for my half an hour mark. I got a little bit closer today. And so feel free. I will send you guys any information that you need. Once again, be safe out there. Wash your hands. Wear your mask. Be careful around people, because you really don't want to get this if you don't have to, because you don't know if you're going to be one of the lucky people. And if you're interested, like I said, on any immune protocols, feel free to contact the office. We can do you via telehealth. Also, we are doing COVID testing for people that are interested and don't want to be in long lines. You do have to establish as a client so that we can track you down afterwards and give you your results. And at this point, we're doing them on Mondays and Fridays. So contact me either via the Facebook page, and our phone number's on there as well. And have a wonderful weekend. And as always, stay healthy and be safe. Thank you, and I will see you next week. Take care.